thank you very much for joining us today. As many of you are probably aware, this is Multiple Sclerosis Awareness Month. So our presentation today is titled Exercising and How the Activator Poles Can Help for People with Multiple Sclerosis. With that being said, we have invited healthcare professionals as well as individuals living with MS to join us today on our webinar. So my goal personally is to hopefully show everybody how they can use the poles, whether it be in the clinic for clinicians and healthcare professionals, or whether it be people living with MS, and really try to identify the versatility of the poles for a lot of different mobility levels. Now, with that being said, this is not medical advice. If you are a person living with MS, we want you to make sure that you're being safe. So please realize your ability levels and utilize the poles in a safe manner for you. If you're currently walking with a walker or have had frequent falls, then my recommendation would be for you to go talk to a physical therapist, and hopefully they can help you implement the poles safely into your exercise routine. So without further ado, let's get started. We're going to start with a quote that I just received from a lady that purchased our poles, and she says, the Activator poles are incredibly amazing. Now, Jackie is a longtime Nordic walker, as well as a person with MS. And she says, she has a great attitude. Drum roll, please. She said, the Activator poles stay at the correct height. Now, let me rave about the hand grips for a minute. Not only are they marked left and right, but the little self-shaped bottom of the grips, I could just lightly rest my hands on them. And the set had me walking around the house with perfect upright posture. Game changer. I almost called my daughter to tell her I was walking with proper posture because of this amazing mobility solution. Jenna is a fourth-year kinesiology major who left for winter break telling me to stand up straight. I'll be shouting praise for the urban polling poles from every soapbox that I can climb on. Now, I think that speaks really highly. Like I said, she has used lots of different poles out there. So I just want to point out a few things that she pointed out. She talked about the poles staying at the correct height. The Activator poles were designed by an occupational therapist and gerontologist to have some additional safety features. And one of them is that pin locking system, like you see in the picture on the right. It locks them into place so that they do not collapse. Most poles have a twist locking system, which aids them at more of an opportunity to collapse if you don't get them twisted as tightly as they should be. The other thing that she mentions in here is the nice little shelf that our poles have. And on the left-hand side, you'll see that little ledge can be huge for a lot of different reasons. One of them is for balance. One of them can be for safety. She mentions them for balance. They helped when she pushed into them. They helped her sit up nice and tall. Some people, it helps them offload some painful joints. So we're going to go through and touch on some of these features further into the presentation. But today's agenda, we're going to start with some introductions. Then we're going to move to the benefits of the Activator poles for people with multiple sclerosis. We're going to dive into exercises for people with MS, and we have two separate case studies. We're going to talk about a research study that is a walking protocol and how you can implement the Activator poles to be able to utilize for that. We'll talk about some great resources, and the goal is to end with 10 or 15 minutes of question and answers. With that being said, I don't think I have anybody else to help me answer questions throughout. So if you have a burning question that is really relevant at the time that we're doing something, please unmute. And I think that you'll be able to just speak up and ask the questions, because I am going to be away from the screen a little bit doing that live demo. If not, hold your question and wait till the end. And like I said, I'll try to get to everybody's questions. If I don't in the time frame that we have, then I will definitely reach out later and answer questions. So my name is Joy Cochran. I am the clinical evidence specialist for urban polling, but I, by trade, am a doctor of physical therapy and owner of Joy Explorations. So in this video today, I'm really going to be putting on my therapy hat to be able to help walk through some of the exercises for the ladies that are helping us out today. The first case study is going to be on Shari. She is a retired executive assistant, a wife, a mother, and she was diagnosed with MS in 2020. She's not live with us today, but we do have some great recordings. And she wishes everybody well, and she will be watching this recording. The second person that we do have live is Vanessa. She was our guest last year for our March webinar. So I have not actually seen her since then, I don't think. So we are going to, she is a horticulturalist and she works in sales for Johnson Nursery. She is a mother and a wife, and she was diagnosed, she believes, in 2017. So we're going to see how she's moving differently this year and go through some other live exercises with her. So we'll start with just some talking about multiple sclerosis. So in general, it is a disease of the central nervous system at its simplest term. And it really disrupts the communication between the brain and body. And that can present in a lot of different ways. But there are 2.8 million people worldwide diagnosed with multiple sclerosis, with 1 million people being in the United States. Usually people will identify their first symptoms or be diagnosed between the ages of 15 and 50 years old. So that's fairly young. And 73% of the people are women. The symptoms for multiple sclerosis a lot of the times start out invisible. So they could be things such as pain, fatigue, vision deficits, maybe some dizziness, numbness and tingling, and cognitive. So symptoms that people on the outside aren't really going to see or be able to identify if they're just looking at somebody. The number one symptom that we hear from patients is that they have an issue or they do not like the fact that they are not walking correctly, and the multiple sclerosis is limiting their walking. Now, secondary symptoms. So if people are starting to get fatigue, they're starting to get dizziness, numbness, they can't walk quite as well as they used to. What happens is that usually there's some inactivity. And when you're not walking or being quite as active as you used to, we will start seeing a loss in muscle tone, maybe some weakness, the posture's not quite as good, decreased bone density, and potentially shallow, inefficient breathing. So we're going to try to talk, I'm going to let Vanessa talk on some of these, but we're also going to try to introduce some exercises today that can address a lot of these. So why are we talking about the activator poles to help with people that have multiple sclerosis? So there are there's tons and tons of research out there in regards to the benefits of Nordic walking or pole walking for a lot of the things that are addressed or a lot of the symptoms for people with multiple sclerosis. So my hope today is to show you that the evidence-based activator poles are really helping to address some of the key rehab and life goals for people with MS. That could be stability and balance, right? So a lot of people call our poles the four-wheel drive. They provide that extra 2 points of contact, so they have the confidence to be able to go out and do things that they want to in their environment. It could be that it helps improve their posture and their range of motion so they can start walking a little bit better. The poles might help manage fatigue and reduce some of that pain, which could help with increased abilities to be able to do activities of daily living or recreational activities, as well as help to strengthen core and upper extremity. And a lot of the times our core, we'll see the core as being one of the weakest points. So that's going to help us with our balance. And really the poles can help to increase weight-bearing activities and endurance, which in the long run, all of these that we've already just mentioned will help increase functional mobility and improve people's quality of life. So this is the expanded disability status scale, and it helps to measure the mobility for people with MS. And so what I don't want to really spend a lot of time on this, but I do want to show you that there are lots of different stages that people go through with MS. So not everybody is going to look the same, be the same, act the same, have the same symptoms. And so there could be people that are walking and there's really not any limitations to walking. Their symptoms are something different than that. All the way down to people that are essentially restricted to a chair or maybe even in bed. And today we're really going to show that our poles are versatile and we can help everybody, whether they're a walker or whether they are restricted to a chair. So this is at the MS gym, Just Keep Moving here. I'm just outside of Milwaukee, Wisconsin, and that's where this gym is at. And so I went there and you will see people using the poles, like I said, sometimes as their main device of walking. So they use them instead of a walker or a cane. Sometimes we're going to be using them as a treatment tool in the clinic to be able to help challenge people's balance. And sometimes we will use them as a combination of exercises and as an assistive device. And so you'll see that in this with this gentleman right here. Um, he's walking with them a little bit, but his main form of walking is with that upright walker on the left-hand side, but he utilized them when we were there doing the demonstration, and he utilized them to help with his sit to stands. So let's dive into the exciting part, which is how to use the poles for treatment and exercises. So really, when thinking about utilizing the poles as an innovative or different way to exercise or to bring them into the clinic to help our clients, one is that they can help increase confidence and stability. So for people that are walking, they might help you maneuver and keep your balance in a busy environment or an uneven surfaces or those kind of things. And for people that are in mostly in a wheelchair, they can help to increase weight bearing activities. We can utilize the poles for balance. So really working on those hip, ankle, stepping strategies to try to reduce some of those reaching strategies that I hear people have a lot. You know, I don't use an assistive device, but I love my couch and my walls, and I've become a surfer, right? So trying to figure out how we can improve that balance so you don't feel like a surfer anymore. And we'll work on strategies and reduce fall risk. And then we can help normalize gait patterns. So poles can help get people upright and symmetrical. Whereas sometimes with a walker, you'll feel hunched over, or with a cane, you're off to one side. And they're not the answer or to everybody, right? But they could be a better solution than some of the assistive devices that are out there. They might help increase efficiency of your walking pattern so that you decrease some of the fatigue and you can walk further. They might, like I said, mentioned earlier, help with some of that pain management. They might help you to stabilize if you have some spasticity in your lower extremity to be able to help get that foot cleared through. And they are going to provide, no matter what you're using them for, a total body strengthening workout. So that ledge is going to, every single time you push into that ledge, whether you're seated or standing, you're going to get that core activated. You're going to get those lats activated, and we're going to get a better overall workout, no matter what exercise that we're doing. So we'll start with our first case study. This is Shari, and I just want everybody to know she's fully aware that we are using her videos and she is completely okay with it. I met her last week, and so she is 59 years old. She was diagnosed with MS in 2020, with really her symptoms starting as low back pain, fatigue, and starting to have some walking difficulties. She is now retired. She was an executive assistant, and she is retired because of her symptoms with multiple sclerosis. Starting in 2021, she has been using a four-wheeled walker like the one that you see in her picture there all the time. She did start with a cane initially, and she went on to tell me that she is a breast cancer survivor, a two-time breast cancer survivor. The most recently was at the end of last year. As well, at the end of last year, she was hospitalized like over the holidays. She had COVID, C. diff, and I believe she was in the hospital for 2 weeks. She has been discharged home home, and she's been working with physical therapy in her home, and she is going to be starting next week with outpatient physical therapy. The day I got there, she was telling me that she was having kind of a bad day because she didn't sleep very well, and sleep can really change and alter her symptoms. So let's take a look at her walking. She is just stood up from a lift chair. She didn't have it lift her all the way up, but she did get a little elevation there. She's walking, and when we get behind her and to the side, you'll be able to see that she has a decreased weight shift to that right-hand side, and she's taking a shorter step length on the right-hand side. Her walking distance is about the distance from her bedroom to her chair before she needs to take a break. And she definitely showed me that she needs a break because she did some plopping when I was there. Um, and her other concern is that she has had falls, not any recent, but when she has a fall, she can't get back up. So during the assessment, I wanted to look at what she looked like from sitting and standing from a normal chair. As you notice there, she's moving her legs to get them in place to stand up with her arm instead of just moving her leg by itself. She's heavily relying on her upper extremity to help, um, instead of pushing off with her hands and then using her legs to stand up. And she did tell me that she feels like her legs are really, really weak right now, and that her arms are doing a lot of the work. So our first day here, my goal was just to introduce her to the poles, and I want her to feel comfortable and I want her to feel successful. So we decided to see what it would look like if she could, to see if she could stand up using the poles instead of the armrests. So the armrests on chairs are solid, right? So it provides her a lot of stability. So she immediately was like, yeah, that's not working. So maybe we can try it with one push off and then one unstable upper extremity using that pole. We're just experimenting here. She can't decide which arms. Right now we're talking about which arm's stronger. So we decided to try the other side. So for me, as a tool going forward, this is an exercise that I'm going to work on, because she's going to be able to reduce the stability that she has by pushing up with her hands. She was determined today. She's like, I'm going to stand with these poles. So right now she has to think about things a little bit differently, because she usually immediately transitions her hands up to the walker. And she doesn't have that there, but she does it. And she looks really good. So now the poles are helping her to be in a weight-bearing position, and they're challenging her balance a little bit more than what a walker does, because the poles aren't quite as stable as the walker. And so highlighting just a few of the extra features that the Activator poles have. As you'll see there, on the bottom, they have these nice big surface area. So those poles are providing her a little bit more stability than other poles that you would find on the market, because a lot of them either don't have any bottoms, they just have like a pointy bottom, or they have these little plastic, really tiny bottoms that are pretty slick, especially on that hardwood floor. Again, while we're standing there, I'm just wanting her to get used to the poles, asking her to push into that ledge, see how it feels, take some deep breaths so that she can really feel that posture open up, her core start to activate, as well as her arms start to activate. And that was about a minute stand. She did really good. She's like, I don't know. It felt good while you were here, but I don't know if I can do that by myself. So I'm like, absolutely, I would not. I completely agreed with her. And so let's just work on a home program that's going to get you used to using the poles, right? And I don't want to introduce something completely new. So she told me that she was left with some seated exercises that included long arc quads, or sitting there and kicking your leg out, heel raises, toe raises, and marching. I said, so let's really work on those exercises, but we're going to put the poles in our hands so we can get that additional core working. So we know that when it gets stronger, that we're going to have better balance, and it's going to help us work on our posture. So some of the key things that I left her with the poles was I asked her to lower the poles to the lowest notch. So then the poles are at a more manageable height instead of being at a standing height, because we always want them to be at a level where you can keep your shoulders nice and relaxed. And I also asked her that when she was doing her exercises to scoot away from the back of her chair so that she can really challenge that core and really be able to actively activate that posture. So here's her on day one, practicing those exercises with the poles in her hands. There's her march. Like I said, she told me she was having a bad day, and she was telling me that she's like, I usually can get higher than this. I'm like, you're working hard, right? So whatever you can do that day, some days are better, some days are worse. So that's what we were left with. And so I was luckily, was able to see her yesterday. So this is visit 2. And she told me that she was coming off of a really stressful weekend. They had gone downtown to their place in Milwaukee. Everything there is a little bit lower. So she has a little and set up a little bit differently. So she gets anxiety, and when anxiety increases, and it makes her a little bit more tired. So again, like, let's just do whatever you feel you can do today. She's like, and her big concern was, I don't know if I'm ever going to be able to walk with the poles by myself. And I said, that's not the goal of the poles for you right now. So the goal for the poles for her right now are to strengthen the core in a seated position, but also to be able to help her be able to be in a weight bearing activity that challenges her balance, right? Which we talked about a little bit on day one. The other is that I really want to see her be able to practice her sit to stands using either both poles or one pole, because that again allows her to not have quite as much stability in the upper extremities. So she has to use the power in her legs to be able to strengthen her legs a little bit better. So let's take a look at this first video. Oh, they're going to go in the wrong order. No, actually, so we'll watch this video and then I'll back up to the picture on the left. So she's using them to scoot. And we were talking about where should the pole be placed when we're working on this. So for you therapists out there, it can all depend. A lot of the times I like them to put the pole out in front of them, because then that helps with that forward lean. And we know when we get that forward lean, our butt comes off the chair. So it helps out just a little bit. And I'm not really doing anything. I am totally just have my hand back there. But she's doing all of this by herself. Awesome. Progress from last week. She was able to stand with one pole in her hand this week. And so I was like, awesome, let's just get used to, again, weight shifting back and forth, because we saw in the first session that she wasn't shifting her weight all the way to her right side. But she's like, nope, gonna take some steps. I'm like, awesome. So we did some walking. And really, I wasn't doing anything. I was there. She was able to stabilize herself. We took about 5 steps forward. She's like, I'm ready. So she was game for walking backwards. I'm like, excellent. Love that walking backwards. She actually felt like her walking backwards was easier than her walking forward, which could be because her hip flexors are a little weak, right? So it's not as hard. But I ask her right here, she's like, where's the chair? I'm like, can you look for the chair? So now I'm adding some head turns in there. So she's having to work on her vestibular system a little bit more. And then we're really working on trying to control that sit, which actually looks pretty good. just a little plop here at the end. And she knows it. She's laughing. She's like, sorry. Anyway, we were able to get 3 of those in. And so when we're thinking about people with MS, right? We want them to get over that fatigue. So since we're just starting to use these, we had pretty long rest breaks in between there, which was great for her so that she could fully recover and so we could get up and do another one. What I was trying to comment on the left-hand side here is that when we were trying to use 2 poles, I put my hand on top of her pole, as you'll see there. And the reason I do that is because then that will help stabilize that pole just a little bit. Not as solid as the armrest, not as wobbly as just having the pole out there by itself. It didn't work this time, but it is a good way or another way to assist as a therapist. And again, she is putting a lot of weight through the upper extremity to help get that walking going. But we have that pin locking system, and our pin locking system allows each poles to hold an individual weight of 200 pounds per pole. So I am not concerned at all about our poles breaking or collapsing. Most poles that are out there are only going to be weighted to like 30 to 90 pounds. So there's a big difference. So there's two comments so far I will touch on right now. One said yes, nose over toes. So yes, trying to get that weight translated forward, right? So that it will help her stand up. And then what about the placement of her feet to facilitate leverage through her legs? Absolutely. That would be something and should have been something that we were working on, but it is something that we can work on in the future. I was trying to manage the video camera as well as just trying to facilitate her trying to get up. But yes, absolutely. I completely agree with you, Cheryl. All right. So next week, she will be going to outpatient physical therapy and hopefully introducing the poles to her therapist. So the one thing that I do like to also comment on is that if you are learning about the poles here and you say something to your physical therapist or your doctor and they have never heard about them, then by all means introduce them to the poles, because as therapists, we want to find the best tools for our clients, because if they can help you, most likely they can help other people. And that's what I found true when I was working in the clinic. So as a therapist, we are always open to learning new tools that are really helping our clients so that we can allow them to help other clients as well. So I just recommend taking them in and showing them off to your therapist, your doctors, all those people. So now we are going to talk with Vanessa. So we didn't really figure this out. So what I think I'm going to do is briefly introduce Vanessa, and then I will have her say a little because I want to show you what her gait pattern looked like last year. And then she can maybe comment on that in regards to how she's feeling things are different. And then I'll totally back out the screen and it'll just be us. So Vanessa is 49 years old. As I said before, she was diagnosed in 2017. Her initial symptoms were tingling in the and numbness in across her abdomen that was radiating down to her legs. She says now that her symptoms are weakness, spasticity in that left leg, and some of the functional things that she has difficulty with is walking because of her spasticity, and as well as stairs. Vanessa uses the activator poles full time as her ability aid to be able to get around to places because she likes the way they look. More so than a walker or a cane, but she does have the stability to be able to use them safely in the environment. And I will let her talk on those a little bit more. But let's take a look at her walking and then I'll turn it over to Vanessa to say a few words. So as she's walking, she said she's like, I tend to be a lot more cautious. Her upper extremities are kind of helping her balance. They are swaying back and forth. The poles help her to keep a more efficient walking pattern and really help to clear that left lower extremity. Do you want to say anything about that, Vanessa?
That's still some of the same things that I struggle with even now is just kind of getting the clearance of that left foot, getting that foot flexion, you know. So I do try and do that at home even, you know, kind of keeping up, you know, because with MS, it's all about maintaining, you know, and hoping to get, you know, more, I don't know, more abilities, you know, as maintaining my abilities as it goes, as it progresses.
Yeah.
Yeah.
So can you, before we dive into exercises, because one of the number one complaints, I hate to use complaints. One of the number one reported deficits that's really impactful for people or is devastating for people is walking. So we're gonna talk today and go through some gait exercises. But can you tell them on a regular basis, like what your routine is? Like what exercises do you do on a regular basis?
Okay. So a lot of what I do is I will wake up in the morning before I go to work, and I do a lot of floor exercises through the MS, not through the MS gym, but with Trevor Wicken, and it's a lot of um, controlled movements using exercise bands, sometimes a ball, strengthening the core, some breathing exercises, some eye exercises that have really helped with my balance over time, um, kind of thing. I use an elliptical bike, like or a recumbent bike, for about 10 to 15 minutes, depending on how well my morning's going and how I slept last night. I totally can relate
You
to
relate to
that.
that? Okay, excellent. All right, well then let's get up and get the poles in our hands and we'll kind of start walking through things.
Okay, sounds good. There we go. I too love the fact that there's a left and right, like on the handles. It makes things so much easier. It's just one less thing.
And how long have you been using the pole?
I have been using these poles since I met you 3 years ago.
Yeah.
3 years ago, I think. Yeah.
And so she was using poles before this that weren't
No.
the activator poles. And so I asked her to try these. And the biggest thing that she identified at that point, which might be different now, was that the twist lock system had a give to it. So the poles would bounce. So she would go and try to stabilize herself to be able to walk. And it would have a give. And so it didn't provide as much security as these poles do.
That's very true.
Yeah.
That's very true. Yes.
So these are the same poles. She has not had to replace the booties or anything, although you want to make sure that you're keeping an eye out for the bottoms to make sure that tread stays nice and good. So it doesn't, if it wears off, then you will want to replace these or they'll become slick and they won't be safe.
And they've been really great, especially in the Midwest with our weathers that we've been having, whether it's rain or snow, even on the ice, these things have held up really well.
Awesome. Yeah.
Yes.
And so, like I said, she uses them every day, all the time as her mobility to be able to get around. But let's just show them some walking. So I'm going to have you face that direction.
Okay.
And just get your feet nice and wide.
Hmm.
And so we're going to work on weight shifting back and forth. So we're going to break down the gait pattern. So really
like up on my toes?
Nope. So just
or side to side?
Side to side.
Oh, okay. There we go.
So really getting some of that side to side weight shifting happening. And the next step is that we are going to do some heel taps. But before you do that, I want you to really think when you're shifting your weight to this side, tightening the butt, right? Standing up tall, letting that leg support you, and then you're going to switch to the other side and doing the same on that side. Good. And placing the poles right now wherever feels comfortable or where you would usually have them for walking.
Okay.
Right? Because that's what we're getting into.
Yes.
So once you feel comfortable breathing, she doesn't have a death grip on this ledge, but every time she's shifting from side to side, she is pushing her hand into that ledge so that it is activating the core and the arm. Good. Now let's do some heel taps. So if we were going to take a step, we would tap that heel. Good. And for some clients, you might start with just doing one leg.
and then it slides back. Sometimes the foot drop gets the best of me on these, but if I keep working at it, then it does get easier.
So on the left-hand side,
Yeah. Yep.
so make sure
that
you're
one's
still
up,
shifting your weight,
that
right?
one,
And then
that
letting it go.
drops.
Yep.
And then I end up having to slide it back. Yeah.
Let me see if we can modify. So with that right there,
Mhm.
take a step with your left for that heel tap. Good. And then knowing that's pulled there, can you?
I feel like I kind of compensated by leaning.
Yes.
Try
Try it one more time and see. Really
Kind
think
of-
about
kind of
bending
the
that
queen of
knee, bending that knee. Yeah. Nope. Okay.
maybe. There we go. Maybe. Sometimes it cooperates.
That's okay. Sometimes, I mean.
And then sometimes I can't even tell if I'm compensating or not.
You can see today because you can see.
Yeah, that's true.
Okay, so let's get back to having our feet about shoulder width apart. Let's shift our weight and instead of heel tapping, let's keep one foot out in front.
Okay.
Good. So not to just move on from that and ignore that, but we know that probably if we had more time, I would work on that left leg, right? And that heel tap and trying to work on the bending of getting that foot back and working on that knee flexion. We are going to now do weight shifting forward and backwards. So you're going to shift all of your weight to your front leg. Good. And then shift it all the way back to your back leg. And then just keep going back and forth.
This one's pretty easy because my right leg is still maintaining really well,
Good.
but it's always good practice.
And your back, so your back foot is turning in just a little bit. Can you keep it more?
My back foot is turning in.
Your back foot is doing this.
Yeah.
Can you keep it straight?
Yeah. Maybe.
Use the screen as your mirror. Your shoulders nice.
One
Relax
more.
if you can.
One more thing to have to consider, right?
Yeah.
Think about. Is it still bending in?
Nope, it's good.
Okay.
All right,
That
let's go back.
Okay.
You tell me when you need a rest.
Okay.
Or if you need a rest.
Okay, so far.
So, yep.
Now, bend, 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 bend. There we go. Okay. Likes to hyperextend at this point.
Okay.
See, but I couldn't do this without these poles helping me balance, honestly. Like I keep kind of having to readjust a little bit. I think that's such a helpful part of these poles.
Absolutely. And one of the other things that I like about the poles is that we're out here so she can really be working on gait, whereas a lot of the times we would have to either, if we didn't have the poles, we'd have her holding on to the countertop or maybe holding on to a walker. So if she was holding on to the walker, she'd be flexed forward. Most of the time countertops or chairs aren't the right height. So she would be either flexed forward or not be able to stand up to the exact right height because we have the poles adjusted to her height. So
with my hip flexors being so tight, like this is always a good stretch.
yes, absolutely. So even just hold it. So bring that knee forward, keep that heel on the ground.
Shifting my hips a little bit
Forward. Yep. So she's getting a nice, good stretch.
It hurts so good, right? Yeah. Oh.
Awesome. While you're doing that, you can do the other side and I'm gonna check some of these
Okay.
comments and questions.
This is usually the stretch that I do on the chair too.
So I use one stick as a cane, and when I go walking, I use both sticks. Is there a guideline for adjusting them for both situations? Are you asking about the right height? So I think I'm gonna answer this. If it's not the right answer, then let me know. So I didn't even talk about adjusting the poles to the right height. So what I'm gonna have you do is step so that you are, yep, your feet are shoulder width apart. What should happen is with the poles just a little bit in front of the feet and just a little bit out to the side, her elbow should be at about a 90-degree angle. Do you want to turn that direction so they can see? So we want her to be standing up nice and tall, and her elbows are going to be at about a 90-degree angle, and that could be adjusted up or down depending on the person. Whether you need it for posture or whether you need it more for balance. And so hers are a little bit under the 90 degrees, but it's what felt comfortable and she really feels secure.
Mhm.
Let's see here. Why is foot width so narrow? Hi, Dr. Cantor. It's so nice to have you on here. Um, how have you prescribed these as part of the home exercise program? So I have not seen Vanessa in over a year. So we used to be working together. And so today she's been decided to be my lovely assistant to help walk through some of the breaking down the gait pattern. So I don't know, it might be the angle, but yes. So what we try to do is to have her feet be a little bit wider in regards to so that they're not so narrow. So it helps her with her balance and stability. So let's go back, and we can usually do that as a little bit of a guide as well. So if we're seeing that, right? So if we're seeing that her gait pattern is a little bit too narrow, when she is stepping forward, we can put something in between there. So if you were stepping forward and it was a little too narrow, there you go. Yep. Even when we're doing our exercises to be able to cue a little bit.
I do always have to, like, I've noticed over time that my feet have gotten closer
More.
together with the gait.
So your awareness, self-awareness is
Yeah.
huge. And so I would say that that's something that we definitely need to be cautious of, correct?
Yes,
Yeah.
for sure. For sure. Especially like when walking in crowded areas with my poles, like it's a lot more challenging with that, I find. So sometimes getting out and doing things, I like to gauge like how popular is this event going to be?
Do you find that people give you more room when you have your poles with you?
Sometimes, yes. Sometimes. I would say it almost kind of depends on the age group. But yes, yeah, a lot of times. They can usually see me coming.
With those awesome poles.
These colorful poles, yes.
All right, so the last step in regards to the gait pattern is the progression of the other foot. So we do these quite a bit. We used to do these quite a bit because it can really help with strength. Do you know what I'm talking about?
The knee lifts.
The knee drags, yes. So we really like to get that back foot back. So she is already getting some extension in that hip, and really kind of, I have her prime up that toe back there, right? So
Yeah,
look at your feet,
I'm already
narrow.
kind of narrow.
There we go. And you're going to bring it back and you're going to drive that knee up. Yes.
Sometimes it wants to bend.
So that's okay.
And
That we're
that's
practicing on that. Yes,
Yeah.
exactly. So making sure that we're driving it up. So we're not just concerned with this leg, exactly, but look at your gait pattern again.
Oh, I'm getting more narrow.
Yeah.
Yeah.
So we could do this again. there's multiple different ways that we could cue that, right?
Yeah.
We could put a target back there for you to make sure that you're bringing your foot back to. Something again, we need to work on. And again, we don't have all the time to do this, but things that are coming to me to be able to really break out, and give her a plan. So, yes, I like practicing on the other leg too, because we are also working on the stance leg. So really thinking about tightening our glutes, making sure we're up nice and.
I need to step back a little further, right? There we go.
Yeah.
And really thinking about driving that knee up.
Yes, to really help with those flexors, yeah.
That pull between my legs makes it very conscious of how far apart my knees are.
Good. In a positive way?
Yeah. Yeah, I think so. I think it'll be a positive way eventually. It feels awkward again, but I think that's just because of like the knee kissing, or I think that's what they call it, right? When your knees kind of go in.
So really think about pushing those knees out, like like the video we were watching earlier, like if there was a strap on the outside of your knees.
Right.
Good. How are you doing?
Good.
Excellent.
Good.
So there's a lot of ways to progress and regress these exercises. Maybe we want to challenge a little bit more and bring out an AirX pad.
Oh, stepping onto.
Yes. Or you could actually do so take and step 1 foot on there.
Okay.
And then drive. So let's just, before you do that, let's just get can you get both feet up there?
Mhm.
So we're working on our balance a little bit.
Yeah.
And then just work on some stepping strategies. So working on those balances that if she were to lose her balance, can she catch herself? So just take a step off and back on and off and back on. Try to work on some speed. Actually, I'm sorry. So both feet are on there.
Okay.
And then can you step your left foot off to the side and then back on? And then
I see what you're saying.
and back
Okay.
on. Yep.
That one needed a little help.
Good.
There's still a little drag pulling that one
Well,
up.
we've been working out for a little bit now too.
Okay.
All right, let me just see if there's any other. So let's take a break.
Okay.
And
Do the chair?
Yep, let's do the chair over here. And a lot of the times what I have people do is when they need a break for fatigue, I have them do an active rest break with poles. So I'll have them sit there, really work on, because we're working on different muscle groups now, really trying to breathe through the exercises. So maybe we're working on our posture, working on activating our lats and sitting up nice and tall, or we might do some stretching activities with the poles up and over our head and going side to side. You probably don't need to do that.
No?
All right. So let's do just some breathing exercises while you're sitting there.
Okay.
So even using the poles to help get up nice and tall, a little bit different way to use them. Good. And then come back down. You can even go all the way to the floor. For people that have low back pain, that might help a little bit. Yep. And then you can go from side to side. Good. You can even use them so that the poles are on the ground and do some of those side to side exercises too. And get some stretches. Yeah.
We did this on the Bosu ball too, didn't we?
Yes, we did. Excellent. Does anybody have any questions? Dr. Cantor, would you like to unmute and say anything additional? We would love to hear from you. In regards to using a brace, it depends on what the brace is for. I'm not for sure what those braces are for. Like, Vanessa has a Bioness brace on right now to be able to help with her spasticity, to try to work through that tone that she's getting, to be able to bring her toe up. And she actually has a cuff that's up on her thigh as well to help with that hip flexion. Shari, that was in there, had a toe up brace on to be able to use it. So I don't not recommend braces. I would, I tried, it just depends on what they're for and whether we've tried to actively be able to, use the muscles, and whether, yeah, so I hate this to be the answer, but it just depends. Would anybody like to see any other exercises, or does anybody out there, whether they're a therapist, um, oh, yes. So a lot of the times, yes. So the question was, do you recommend braces? And this brace is to improve lifting the foot. A lot of the times, like I said, yes, we will try to do strengthening within our sessions of therapy, and but that doesn't always make it feasible. So we do use other things to compensate, to be able, compensatory strategies such as braces, to be able to help. Um, Does anybody else have any comments or exercises that they want to show? The more walking, the better. Yes, absolutely. And that brings me, let me just bring up my final slides here. We do have a protocol that I want to get to before we finish here. So this is just a look at that scale again, and some of the different ways that we either have gone over today, or that we can utilize the poles at each of the different levels on the scale. So sitting, we talked about activating the core, upper extremity, using them for functional mobility. We can use the poles in static standing to benefit all systems, right? So increased weight bearing tolerance, work on balance. We can use the poles if they have limited ability of taking steps safely, to be able to challenge balance while we're walking. If you're with somebody safely, we can use them for transfers, all the way up to being able to walk using them to be able to challenge dynamic gait on various surfaces and terrain. So lots and lots of versatility in regards to how we're using them. Just some general exercise guidelines for MS. Like today, we were just going over some brief review of exercises and trying to walk through things. But the guidelines say that aerobic exercise should be done 2 to 3 times a week for 10 to 30 minutes. We should have a resistance training program, or weight training, strength training program 2 to 3 times a week for 1 to 3 sets of 8 to 15 reps. Balance training 2 to 3 times a week for 10 minutes. And hopefully we'll be achieving a lot of these with moderate intensity, so that we can get our heart rate up, because there is research out there that shows that moderate to high intensity exercise can help with neuroplasticity, or help slow the progression of multiple sclerosis. One of the walking protocols that I wanted to point out is this one by Karpatkan et al., which I probably butchered that, from 2020. And they did some research, again, showing that they did some comparisons between a non-exercise group and an exercise group. And this one specifically, they had people doing a 6-week high-intensity interval training. So they were trying to get people for walking as fast as they can for 20 seconds. And then they would let them rest for 1 to 6 minutes. And that rest break depended on their fatigue level, because they wanted that each exercise bout to be as fast as they could. So the initial one started with 8 fast walks. And then as the 6 weeks progressed, each time that they had a session, they would increase the bouts by about 2 each session. So it went up from 8 to 10 to 12 and so on and so on. And what they showed was that there was significant improvement with gait speed. So how fast people were walking, endurance. So how far people were able to go in the 6-minute walk test. And they showed improvement in balance, which was showcased by the mini best test, the balance, dynamic balance portion of the mini best test. So great, like Dr. Cantor just said, walking as much as you can, making sure that you're trying to get some speed in there, that moderate to high intensity exercise. There's multiple ways that you can do that. But there is definitely research out there that shows that it is beneficial. And so what I'm thinking that we would like to do is that if there's anybody out there, we're going to do an unofficial research study. So if anybody's interested in starting, what we'll kind of do is do that protocol, but we're going to add polls to it. Let me know and we'll start a group where we can kind of go through and we'll coach through that. But if anybody's interested in following that protocol with a little bit of assistance, just so that we can see what the outcomes are, if they're any different with polls, then reach out to me at joy.cochran@urbanpolling.com. And we will hopefully get that started within the next few weeks. We'll at least be talking to you about that. And then resources that are out there. We have upcoming podcasts next month. Next month is Parkinson's Awareness Month. So we have a few podcasts that will be coming up. There's going to be a webinar on April 25th in regards to Parkinson's. And then we have a new Activator course, which is our continuing education course coming live on April 1st. So if you are interested in that, please, again, reach out to me at joy.cochran@urbanpolling.com and I will get you a coupon code to be able to take that on-demand course. Again, it's coming out April 1st. And then I just wanted to end with two celebrities. This is Jamie Lynn Sigler. She's on the right. She was with the Sopranos, and then Christina Applegate on the left. Both of them utilize the Activator poles. As you'll see in this picture, they just started a new podcast that's called Messy. And Vanessa told me that it's phenomenal.
So good.
So please go check that out. I am going to check it out after today, but we want to thank everybody for being here. I hope you found this useful. I hope you found some new exercises that you're going to be able to do with the poles in order to help your clients with MS. Or if you have MS, I hope you were able to find some new exercises that you're going to be able to do safely at home. And without further ado, let me just see, there's one other comment out here. Love my Activator poles. They help me minimize lower back pain on the right side due to left side foot drop. Also use a Dictus band when walking long distances. Managed to hike the Grand Circle National Parks in October of 2023. Never thought I could do this after 18 years post-diagnosis. Thank you. And thank you everybody for being here. Thank you for your testimonials. We really appreciate that. And we will see you soon. Thank you.